For a small percentage of men, a jolt of pain to the testicles can trigger an unexpected wave of pleasure. Today we're going to unravel the strange neurology that makes this possible, and I'll tell you exactly when that sensation crosses the line into a medical emergency. I'm Dr. Julian. Welcome to the channel. This is a topic that fills my inbox with questions, yet remains shrouded in silence and shame. We're discussing the deliberate infliction of pain to the male genitals, often called ball busting or CBT. By the end of this video, you will understand three key things. First, the unique biological design of the testicles that creates such profound sensation. Second, the precise neurochemical shift that can flip pain into reward. And third, the critical safety boundaries you must know if you or a partner engage in this. Let's begin with the foundational question. Why would a structure, evolutionarily designed to be protected at all costs, become a source of erotic stimulation for some? To grasp that, we must first appreciate why a strike here is so uniquely debilitating. Your testes originate deep inside the abdomen, near the kidneys. As they descend into the scrotum, they bring their intricate network of nerves along for the ride. This is why an impact isn't localized. You feel it radiate into your gut, sometimes causing nausea and cramping. This exquisite sensitivity serves a purpose. It forces protection of the organs essential for reproduction. But if it's supposed to deter harm, how can it ever feel good? The answer lies not in the testicles themselves, but in the brain's remarkable processing center. Your mind doesn't have completely separate filing cabinets. For pain and pleasure, these experiences activate overlapping neural territories and can both stimulate the release of dopamine, the key motivator chemical. The conversion hinges on several factors. The first is anticipation and context. If you consciously choose and expect a sensation, your brain can send a preemptive signal that primes your neural pathways to interpret the incoming data differently. Brain scans show this shift in real time. Second, individuals who enjoy such practices often show heightened activity in the brain's natural pain inhibition circuits, especially within an intimate or trusting scenario. Third, we see powerful neurochemical cocktails at play. Activities that mix pain and arousal can significantly boost endocannabinoids. These are your brain's internal reward tuners, enhancing dopamine's effects and creating a let's do that again feedback loop. They also release beta endorphins, which dull pain perception and induce euphoria, and oxytocin, which fosters bonding and trust. The psychology is equally powerful. For the recipient, there can be intense arousal in surrendering control over one's most vulnerable area to a trusted partner. For the giver, the neurochemistry differs, centering on the satisfaction of controlled power and witnessing a partner's response. Finally, innate individual variation plays a role. Some nervous systems simply crave more intense stimulation, and there appears to be a biological basis for differing pain thresholds, potentially linked to genetics. So, what does this practice actually look like? The spectrum is vast. On the mildest end, gentle squeezing, soft taps, temperature variation with warm or cool objects, and light binding with soft fabrics. These carry minimal risk. Moderate intensity involves firmer hand pressure, controlled slapping with an open palm or padded implements, the use of ball stretchers for gentle weight, or chastity devices that create sensation through confinement. The intense end involves specialized impact tools, wax, or electrical play, realms where expertise from seasoned practitioners is non-negotiable. Most people operate in the low to moderate range, which is also where safety is most manageable. During a typical safe session, sensation is intense but fleeting. There might be mild, transient aching or redness. That fades within an hour. An injury feels radically different. Sharp, worsening pain that doesn't subside, escalating redness or heat, and an inability to move normally. You must be able to recognize 3 true urological emergencies. Number 1, testicular rupture. This is a tear in the testicle's outer wall. The signs are sudden, excruciating pain and rapid, severe swelling. This is a surgical emergency. Number 2, a hematocele. This is a pooling of blood around the testicle, causing major swelling and dark purple or patchy discoloration. It requires urgent evaluation, as pressure can compromise blood flow. Number 3, torsion. This is when the spermatic cord twists, cutting off circulation. You'll have severe one-sided pain, often with nausea, and the testicle may sit at an odd angle. You have roughly a 6-hour window before tissue death begins. It is a race to the OR. Your health is never something to be embarrassed about. Beyond acute trauma, consider chronic effects. Repeated significant impact can impair sperm production and testosterone levels over time, potentially affecting future fertility. If you choose to explore this, follow non-negotiable safety protocols. First, explicit ongoing consent and a clear safe word or signal. Second, educate yourself on techniques, always starting gently and incrementally. Third, maintain communication throughout. Fourth, never leave a bound or restrained partner unattended. For any device applying continuous pressure, like a stretcher or tight binding, release it every 15 to 20 minutes to restore blood flow and prevent ischemic injury. Post-session, examine yourself. Look for symmetry, normal coloration, and ensure any tenderness is fading. Never mix this play with alcohol or recreational drugs, as they blunt crucial pain signals and impair judgment. Regarding chastity devices, proper fit is critical. Too tight causes damage, too loose causes chafing. Silicone or adjustable options are often safer than rigid metal. Take regular breaks for hygiene and circulation. And this is my most important plea. If something goes wrong, seek medical help immediately. As a urologist, I assure you, we have seen it all. Our purpose is to heal, not to judge. Your sexual practices are protected by strict confidentiality laws. Delaying care can turn a reparable issue into a permanent one. Safety isn't a mood killer. It's what allows exploration to continue. The bottom line: consensual adult exploration is valid, but informed caution is mandatory. Know the risks, respect the boundaries of your body, and recognize the red flags that demand an ER visit. Your well-being is paramount. If you found this breakdown valuable, please hit the like button. It truly helps the channel. I'm Dr. Julian. Stay curious and stay safe.